Hi to all of you, and thanks for joining us on this beautiful June morning. Thanks for taking time out of your busy day to help and collaborate and learn together. So the title of my presentation is Assessing and Improving Organizational Health, Pathways to Effective Partnerships. So first I'm going to try to do is convince you why partnerships are so important based on some of my experience leading nonprofit organizations. And then I'm going to talk about ways that we can assess our organizational health in the nonprofit communities, and then give you some suggestions for how you might go about improving facets of your nonprofit organizational health. As Michaela mentioned, I work for Epilepsy Foundation New England. Just a brief mission moment for you is that we serve the 104,000 people living in New Hampshire, Massachusetts, Maine, and Rhode Island who are living with epilepsy. And we do that with a continuum of programs that are designed to help people have better health, physical and socio-emotional health outcomes. We are very fortunate to have funding from Volunteer New Hampshire for an AmeriCorps program in New Hampshire, and we also have a emerging AmeriCorps program in Massachusetts. Okay, so first I want to talk for a minute about collective impact. The concept of collective impact really started in 2011 with this article that I have linked to you here that I would encourage you to read when you have a moment. This article, the basic tenet of this piece was that large-scale social change comes from better cross-sector coordination rather than from the isolated intervention of individual organizations. And it's hard, I think, in the nonprofit community to consider collaboration versus competition when we're all working so hard to make sure that we have the funding we need and that we have the visibility we need. It's hard sometimes to try to keep in mind that our mission is to improve the health and well-being of our community, our clients, the environment, arts and culture, education. And if we keep our eye on the prize of what is the mission, and let that guide our work, I think that we end up in a much stronger place as a community. And isn't that what the nonprofit sector is all about, is ensuring that we're doing the best we can to improve the health and welfare and to really make sure our missions meet their mark. So I think when we work together as partnerships, what we end up is that the sum is greater than the parts. I don't mean to be cliche. I'm going to give you in a second some examples of where I've seen that to really bear out in the nonprofit sector. And I've seen time and time again that when we do this together as nonprofits, that it's not the case that we have, that there's this pie of money, and when we work together, that your piece of the pie gets smaller and smaller as there are more people at the table eating the pie. Instead, what we've seen time and time again is that when we work together effectively, we grow the size of the pie. So many, many times, and I'm going to give you examples in a minute, when we've been able to really focus on the mission, to think about how we can collaborate in order to advance our mission and increase our impact, then we do so much better for our communities. So why partner? I've just made a little bit of a case for you, and then I put why I partner, because I'm going to give you some specific examples of the work that I've been involved with and how it's played out, why collaboration and partnership is so effective. So in 2006, I wrote a federal grant called Bringing Together Schools and Mental Health Systems to Improve the Welfare of Children, the Social Emotional Support of Children. And this funding, federal funding, was in direct response to the school shootings. And the idea here was that schools can't do it alone. We cannot impact the well-being of children enough such that we can prevent the types of social emotional issues and violence that have been percolating in the United States for about a decade at this point in 2006. And so I brought together a group of organizations that were involved in mental health with the school system I was working in. And there were about 6 organizations involved. And we worked together to really analyze what was working and not working in terms of serving children's social emotional health. And ultimately, we came up with a system that really said, hey, the schools can't do it alone. We need a referral system so that when kids in the school system are identified as in need of service, that they have an effective way. And we recognize that the hardest part when you're a parent or caregiver to a child that has mental health issues, unless you happen to be an expert in mental health, you really don't know where to begin, how to find health insurance, understanding which providers take what. Do you need a social worker, a master's in marriage and family therapy, a psychiatrist or a psychologist, and what's really practical for your child. So we created this little system called Project Interface in 2008, and it was designed to help children in this one school system in Massachusetts be able to access mental health care more effectively. So today it is 2020. This Project Interface today, today it is a product of one of the partners in that initial program. It started with a public school system and ended with a university. And the Interface Referral Service now has funding from the Massachusetts state government as well as many other private sources. And if you live in one of the communities that are covered by Interface, which at this point is many, many, many communities in Massachusetts, you can call this referral helpline, which is staffed by students at the university. William James College provides master's level and doctoral degrees to the mental health field, and they will bring you to a database of people who can help you or your family or your child. And these are people who have been vetted in the system, including the referral helpers understand if they're taking new patients, what kind of insurance they take, and can guide the family to connecting with effective services. In addition, there's sometimes a wait for people to access mental health care, and these referral helpline folks can help provide brief intervention while the person is waiting to be seen by a provider. It has approximately a 99% success rate in connecting families who need mental health support for their children with mental health within 3 weeks of calling. And that's pretty remarkable because in Massachusetts, the wait list for mental health support is between 4 and 6 months for children. So that's one example I wanted to share with you. Similarly, in 2008, I wrote a federal grant proposal called Safe Schools, Healthy Students, and it brought $6 million of funding into the city of Newton, Massachusetts. And the idea was for cross-sector collaboration to ensure the safety and well-being of children. There were 14 agencies involved, and the idea was to work together as a community to understand how we could best support the social emotional development of children. And so what we did was work together truly as a community to share our understanding of the strengths and weaknesses in the system and to create a strategic plan that would bring new services into the community. And we tried really, really hard, and I think we were very successful to be sure that we were agnostic about the organization. So it didn't matter whether the resource was coming into the Newton Public Schools or the YMCA or Big Brother, Big Sister or the police department or the hospital or the university. The list was pretty long. And that program led to massive changes in the data reported under the Youth Risk Behavior Survey for the city of Newton, and widespread change in terms of curricula and how programs are organized in Newton, and enduring change in how the community works together to support children. I also spearheaded Project Learn at the University of Massachusetts. I provided a link here, and I won't go into detail because hopefully you're hearing the flavor of the work that I really enjoy doing and what's been effective. Project Learn is a partnership between the business community, the nonprofit sector, and the Lowell Public Schools. And the idea is to work together to ensure that the Lowell Public Schools have what they need to be successful. You can read more about Project Learn there, but at its core, it wouldn't work without all of those sectors coming together. The University of Massachusetts, the Lowell Public Schools, the business community, first and foremost, who really created this project, the Greater Lowell Community Foundation, and the rest of the nonprofit community. One of the things that came out of Project Learn, we worked together with local nonprofits like Mill City Grows, as well as Aramark, the food service company for the Lowell Public Schools, to create a successful U.S. Department of Agriculture grant called Farm to School. And in short, that program led to everyone working together to improve healthy school lunches, including by creating school-based community gardens that are managed by volunteers that are used for STEM, so helping children learn science, technology, engineering, and math, as well as to be harvested to feed poor families in the area. I was at William James College in 2014, and one of the things we did there was work together with all of the hospitals and community healthcare centers in Eastern Massachusetts to create a new system to build the pipeline for psychologists working with communities of color and low-income communities. And then finally, I'll mention Summer Promise, which you can take a look at. Really good example of a community collaborative where the mayor is the driver in Somerville, Massachusetts, for ensuring that the nonprofit community works as a unit to monitor the community's growth and development and to ensure the community has the systems in place to respond to changing needs. I was a consultant on that project for 2 years, and that resulted in $4 million of funding to improve the physical health and wellness of the community by creating things like improved sidewalks, improved after-school physical education programs, improved curriculum in the school, and improved services before and after the school day around helping children get moving, which we know is a really important part of their academic achievement. Okay, so relationship fundamentals. When we think about relationships in the nonprofit community and in partnering, it's really interesting to draw a parallel to relationships in your personal life. So what is important when you're looking for a partner in your personal life is also sort of what's important when you're looking for a partner in your nonprofit leadership life. So one of the most important things for many people is attraction. Do you feel attracted to the organization that is approaching you or that you want to approach? Do you have trust? So it took a long time in those examples I mentioned to build trust in the nonprofit sector. In some communities, there is a lot of fear of working together. There's some organizations that just want nothing to do with collaboration, and part of that is again, fear that my resources will shrink, or that you'll take my board members or my star volunteers, or that somehow you'll get a bigger share of what I need to succeed. And so you have to build trust and understanding between the organization. You also have to have shared values. So there are some organizations that you'll find it's impossible, or I have found that it's just very difficult to work with. For example, in the Newton Partnership, one of the programs we started was a mentoring program. So we had a school-based mentoring program, and there was a mentoring program at 3 other nonprofit organizations in the community. And 2 of them came to the table and built trust with us, but the 3rd never could join. They were just too insular and didn't have the same shared values we did about working as a community. Open and honest communication. So more than ever, when you're trying to build a community collaboration or a partnership between nonprofit organizations, I think it's important to be transparent, to be honest. You don't need to hold your cards close to your chest. You should lead with integrity. This includes things like making sure that there's an agenda for meetings and that the minutes are circulated to all members that were present at the meeting and all members who weren't present at the meeting. This is not a time when you're building relationships to be overly, yes, to be strategic, but to be strategic with utmost integrity. Respect. So do you have a favorable opinion of the other organization? Do other organizations have a favorable opinion of you? And equal commitment. So you have to work really hard to ensure that collaboration can happen, that all members of the collaboration or partnership share the common goal and are equally committed to getting it done. If you have a collaboration of more than 2 agencies and one agency just consistently misses meetings or fails to provide data or fails to have representative communication in online sharing platforms, other members of the collaboration are really going to resent that. So it's important that everyone understands how important the collaboration is, especially now when no one has any time. So we need to be sure that people understand the rules of the road when it comes to collaboration. Working through issues together. So I think calling a spade, and as I mentioned in the equal commitment example, if there's a nonprofit partner that's part of a collaboration or part of a small team that isn't working together, I think it's important to have direct communication about why that's a problem and how we can work together to solve it. Again, being transparent and ensuring that people understand what the project goals are and how to be successful and common goals. In all the collaborations I just mentioned, we worked together to ensure that there was a strategic plan for the community and that the goals were transparently developed in a clear planning process that was open to all members who wanted to be part of the planning process, and that we consistently shared out the strategic planning. And I'll talk about strategic planning in a second. So strategic planning often refers to just one organization, but I think in developing community collaborations can be really important to the community collaboration as a whole. So relationship fundamentals are collaboration fundamentals. So you do need to sort of take a look in the mirror and ask, are you an attractive organization? What is your reputation in the community? Do people have a favorable opinion about Epilepsy Foundation New England? I can tell you that 10 years ago, that wasn't really that true. So we really needed to work hard to build our reputation. Your leadership reputation, whether that's your executive director, your board members, they have a presence in the community, and are they someone people want to get to know? So currently the chair of the board of Epilepsy Foundation New England is Dr. Andrew Cole, and he is the chief of epilepsy at Mass General Hospital and a professor at Harvard and a past president of many professional associations. He's really well known in the community. So he's really has a great reputation, and that helps us when we're building partnerships today. Is the leader of your organization known as a systems leader? So someone who is dedicated to partnership and collaboration and to fulfilling mission. I was just thinking about this yesterday as I was reading the report about what happened at the Soldiers' Home in Holyoke, Massachusetts. And one of the things that was terrifying and frightening what happened there, but the leadership team was described as a group of people who really didn't take any advice from their staff, didn't take any advice from the community or family members, and clearly were not known as systems leader, but were leaders, but were known as sort of a small group of, I don't want to say dictators, that's not quite the right word, but people who really just didn't take partnership. They just did what they thought was best without taking advice. So you need to have a reputation as someone who's open and willing to listen and work together. What are your organizational values, and are they evident? So I do this exercise with my team at least once a year to think about what our values are, what our organizational values are, what our individual values are, and how those things intersect, including how do we demonstrate those values in the work that we do. So if you haven't done that, I think doing an exercise and identifying the core values of your organization and encouraging people to consider how their individual values intersect with them is a really thoughtful exercise to get people on the same page. And can you be trusted? So in a relationship, personal relationship, trust is important. Same thing in the nonprofit community. And can you be trusted to fill your role? And all these things work together to increase your attractiveness and increase your ability to partner. When you're thinking about creating a community collaboration or a partnership between nonprofit organizations, you have to think about what your value proposition is. With mission, I mentioned before that it's been really important to me in my work, in collaboration, and in mission that I maintain a sense of being organizationally agnostic. And what that means is that I focus on the mission. I encourage my team to focus on the mission over what is best for my organization specifically. So for example, Epilepsy Foundation New England is an independent affiliate of the Epilepsy Foundation of America. And that means that donors approach us with a variety of desires to contribute to the greater good. Something that we don't do at Epilepsy Foundation New England is fund research in epilepsy mortality. So there's a specific group at the national level called the SUDEP Institute. SUDEP is Sudden Unexpected Death in Epilepsy, and that's what they do. So if a donor approaches me or my team and says, I'm really interested in SUDEP, and I really want to give to SUDEP, it would be, one strategy would be to say, oh, well, let me tell you about what we do for bereaved families in New England. We provide grief counseling, we provide support groups, we have a campaign called Light the Way Today, and try to redirect the donor's focus to our work. But instead, we have a pact that we will make sure that that person is connected with the National Epilepsy Foundation and the SUDEP Institute to ensure that their intent is met. And that's being organizationally agnostic, because both things are important. Our local services are important, and research on the national level is also important. With your value proposition, I've had a lot of luck building collaboration based on the opportunity to seek grants together. All those examples I gave, there was some amount of, hey, let's work together to apply for this federal grant or this private grant together, and that really helps people come to the table when you have a value proposition that includes, let's work together to seek additional resources. And I put money here, but we also have a really strong advocacy and public policy division. And we have a very, very strong advocate, someone who's been in the field for, I don't know, 40 years. So when we're working together for advocacy, people come to ESNE because they know our Bill Murphy will be able to effectively navigate the waters in Massachusetts and Rhode Island. So we're often invited to coalitions to advocate together for things like better access to healthcare, which is not only important to epilepsy, but to many other disease communities. That kind of collaboration is super important to us, and we couldn't do it, I don't think, without Bill's reputation and his value proposition. Reputation, we've already been over. What do people think of your organization in the community? And you probably know about this, and I think you need to be honest with this. Like, what do people really think about your group? And if you don't know, having some focus groups in the community might be a good way to figure out, do people have a good sense of who you are? So if you're the Boys and Girls Club in Somerville, do people have a good experience with you? How do you know? You probably should have some data on that. What other kinds of support can you bring to a partnership? At Epilepsy Foundation New England, we have a very strong volunteer network, and so when we're working together with other nonprofits or hospitals, we can demonstrate the leveraging of volunteers, which I know is fundamental to the AmeriCorps program. Similarly, we have strong partnerships with hospitals throughout New England, and we can help connect other nonprofits into those hospitals, so that's our value proposition there. And then, do you know who I am? So depending on who you're connected with on your board or other parts of your organization, that can really carry a lot of weight. I mentioned before that we have a really impressive board chair who's really well connected, and that's super important to our success. Beyond that, we have a professional advisory board that's not part of our board of directors, and it's a group of 30 epileptologists, that's neurologists with specialty training in epilepsy. And just being able to demonstrate to our corporate partners and other nonprofits, here's a list of 30 people in 12 epilepsy centers that we're connected with, is important so that people know that we're serious and we have the backing of serious people. And then thinking in partnership about what is your pitch. So as you're approaching nonprofits to partner with, ensuring you identify what your common goal is, how your partnership would be mutually beneficial, and the ways in which you add value. I've done this a lot, creating cross-sector, cross-community, sometimes statewide coalitions to get the mission met, to improve our collective impact. And I will tell you that actually demonstrating these things in a white paper that's 1 page long is an important way to get your foot in the door and to have an elevator speech ready. So to add value, are you strong enough? So that's the heart of our presentation today, is talking about this organizational assessment. I provided a hyperlink to it here, and would encourage you to take a look at the Casey Foundation and download a clean version of the organizational assessment tool, which we're going to go over now. So this is a screenshot of the organizational assessment activity created by the Marguerite Casey Foundation. I have to move you guys around here. Oops, let me go back. All right. So the organizational assessment activity in this particular tool, I was looking to understand a good self-assessment for my organization this spring, this winter and spring, and I came across this tool when I reviewed some literature about organizational assessment tools, and this hands down got higher marks from researchers across nonprofit organizations and across disciplines. So this organizational assessment activity is designed to assess capacity, and there's 3 types of capacity that ultimately they're looking for that the Marguerite Casey Foundation believes are essential to nonprofit organizations' strength and success. One, organizational capacity is your organization's ability to continue your important work over time and to support your program. So that's thinking about longevity, sustainability. Do you have what it takes to be a staying power in your community? Second, programmatic capacity, your organization's ability to effectively conduct its activities, such as advocacy or delivery of services. Are your programs effective? How do you know? And how can you ensure that your programs really are contributing to the mission that you have stated? And then adaptive capacity. This last one has been more important than ever over the last 4 months. But your organization's ability to innovate, learn, and anticipate challenges and opportunities in our continuously changing world. Gosh, that's really been a remarkable sense of strength for EFNE over the past 3 months, and I hope in your cases as well. So you can read along the bottom that how you do this activity is ideally you create a leadership team or a team of people to do the assessment, and the tabs below mark the different aspects of your organization that the organizational assessment tool walks you through. So I did not do this with a group of people because I didn't have the time, especially during the pandemic, to do that. But I found it really helpful as a leader in my organization to go through this tool myself and think about the different facets of the organization. As we head into the fall, I will do this with members of my executive committee. But as you'll see, there are questions that are asked that if you're the executive director, you may be the only one that can really answer all of the aspects of the tool. Okay, so it takes you through all these segments of your organization, and then it gives you an extremely helpful results page that gives you advice on how to move forward and demonstrates to you in an infographic way where your organization has the most strength and where it might need some improvement. It's really important in thinking about allocating essential resources, especially during this time. So here's an example of the Programs and Services tab. I again encourage you to look at the whole tool yourself when you have time, but we won't go through every single assessment. We will go through some ideas of how to strengthen your organization in each of these areas. So in Programs and Services, you see you get to rate each facet by agree on a scale of agree to disagree. And you can read for yourself here, but thinking about that number 39, our organization makes a conscious effort to know the cultural needs, the people we serve. Our organization's programs and services are responsive. Our organization makes programs and services available around the schedules and lives of the people we serve. So hopefully you're getting the sense here that this is a very, very thoughtful approach to thinking about what is working and not working in your organization. It was very thought-provoking to me to think about these detailed facets of our programs and services and all the other parts of our organization. So this is what the results page looks like, or part of the results page, and it gives you a map of what your capacity balance is. So the orange is organizational capacity, the yellow is programmatic capacity, and the gray tan is adaptive capacity. And then this paragraph I think is really important. Your organization's capacity includes many factors that influence its ability to manage operations effectively over time. Successful organizations of any size will seek to maintain balance between their ability to create social value, secure organizational stability, and their ability to identify emerging needs and anticipate or respond to changing circumstances. So I think this is important as a leader of your organization. We can all get overly focused on one aspect of our organization. Primarily, I think most people get overly focused either on programs and services or on development. and thinking about it as a whole and what you need to really think about your organization's success over time as a whole. So this capacity chart is actually Epilepsy Foundation New England's capacity chart, and I'm really, really proud of this. We've been working very hard over the last 4 years to get here, and when I saw these results, it really made me feel, like I say, a sense of pride in what we've been able to accomplish and how we have really good balance right now. And to be honest, that's been essential to our survival, and actually not only survival, but our ability to thrive over the past 3 or 4 months, and to set a chart for the new year that includes maintaining programs and services, even as we change them to respond to the virtual world we're living in. And then in addition to that larger plot map, they also give you this very detailed, sometimes a little bit complicated to read at first, infographic that I'm very visual, so this really helps me to understand my organization's strengths and weaknesses. So what you see is that yellow line is programmatic capacity again, red or orange is organizational, and that grayish line is adaptive. And so this really takes a look and tells you exactly what you would need to work on if you were going to take these results and make them actionable, which I strongly recommend you do. So what you'll see here is, for example, our gray line under leadership and board engagement is strong, except it's not adaptive. So it is hard for us to respond to change. So for example, if I got hit by a bus tomorrow, it would be hard for the organization to continue on its path because we don't have a really great leadership succession plan. And unfortunately, we saw this demonstrated really strongly this winter and spring. Our beloved and very strong previous board chair had a stroke and was incapacitated. And so we had to move quickly as a board and as a leadership team to ensure that we were ready to move forward. And it was a little bit, it wasn't clear who the next leader would be right away. And so those unexpected changes are important to be able to respond to quickly. Similarly, you'll see here that under measurement and evaluation, we're doing okay, but we really could improve our organizational capacity. We have some limited professional evaluators helping us, including a wonderful intern who does a lot of our work, but we know going forward that we need to invest more in evaluation capacity to really strengthen this part of our organization. And then you see financial management. This is an area where we really have room for growth. I think we're doing good, but we need more support here. We had a change in our director of business within the past year, and we're still recovering from ensuring we have the financial management tools in place to have the strongest Epilepsy Foundation New England that we can. And then I'm giving you an example here. I changed some of the results in the tool under measurement and evaluation. I gave us much lower marks to show you what it would do to the chart. So you would expect a chart that looked a little bit more like this if you had areas of significant weakness. In this particular case, it would visually demonstrate to not only you, but your board and other decision makers why it would be important to invest in measurement and evaluation. So let me stop there and see if there are any questions, Katie.
I haven't seen any more. Somebody did give the feedback that they like the idea of having an online survey to gauge reputation. So I think folks are finding this useful.
Great, thanks, Katie. So here are some examples of what Epilepsy Foundation New England has done to have transformational change between 2016 and 2020. So when I came to the organization in July of 2016, things were not going so well. We had a reputation problem with doctors and hospitals. We had a reputation problem with donors, and we had a reputation problem with clients. And the reasons for that is that we weren't being an effective organization. There wasn't really a clear plan going forward. We had a small board of directors who had been on the board of directors for upwards of 20 and 30 years. Our staff didn't know what they didn't know what they were responsible for, nor in most cases were they qualified for the roles that they had. It was difficult to articulate our programs, what do we actually do, and to demonstrate to donors and clients that we were being effective in our programs. It was also the case that we had not necessarily mission drift, but just sort of had become a reactive organization instead of a proactive organization. So we just took on things as they popped up. So for example, a board member suggested we really should be doing a better job of serving veterans, and all of a sudden there was a veterans program, but there really hadn't been thoughtful consideration of, do we really need a veterans program, and do the veterans really want our help? And by the way, the answer to that question is no, they don't really want our help, because they have a very strong epilepsy program within the VA that is actually prohibited from working across channels with nonprofit organizations like ours, which is a good example of a difficult partnership. Not difficult, it's just that there's rules around the federal VA that we can't navigate. Our donors we had an issue with engaging our donors. We had an issue with thanking our donors. When I came in July of 2016, we had donors who had given gifts of $500+ who hadn't received a thank you note in 9 months, or even an acknowledgement that they had made a gift, and that's obviously a huge no-no. And then we had a brand problem. So EFNE's brand in 2016 was either unknown, weak, or in some cases damaging. So we worked on the aspects of the organizational assessment tool that I just showed you to create a path forward, to create a strategic plan, and to really think through all aspects of the organization. Today, I'm happy and proud that we have a defined continuum of impactful programs that have program evaluation data. We have a really strong, diversified board of directors that has board job descriptions and term limits and a nominating committee and things that ensure that the lifeblood of our organization, leadership, continues to have fresh perspective and reflects the diversity in our community, and also that they have strong rules about how the board does business, and that the board understands what their responsibilities are as board members. Our professional advisory board I mentioned earlier, back in 2016, it had 8 members that met once a year. Today there are 30 people who meet quarterly, and they have a strong professional advisory board chair as well. And then to ensure that we had consistent input from the large geography that we serve, we developed regional councils. So there are leadership councils, for example, in Maine and Eastern Mass and Western Mass, and those people meet monthly to tell us how things are going in their area and to ensure that we understand the strengths and challenges happening in those areas. They're also important boots on the ground when we have a walk for epilepsy or other types of programmatic activities. We do today have diversified revenue streams, including we were able to access some federal grant funding. Our donor base has increased by 3-fold since 2016, and we have we have a staff that can get the job done, who understands their roles and responsibilities. I think who have supervision and performance goals, and who are evaluated regularly. In addition, we have a really strong complement of AmeriCorps members in New Hampshire. And that program is growing in Massachusetts in the coming year. And then we also have been able to develop professional volunteer management systems and have roughly 350 volunteers who help us today. So thinking about planning, there are 2 things I would urge your organizations to do. One is to ensure that you have a logic model in place, and the second is to ensure you have a 3-year strategic plan. So a logic model, if you have not heard of a logic model before, it's an infographic planning tool to ensure that what you think you're doing is actually what you're doing. So it gives you a chance to really stop and think, what's going on in our community? What are the needs, gaps, and strengths? If we are really authentic about this and we take some time to review the research literature, the current community data, feedback from surveys and other program evaluation data, and really think about what's going on today. Maybe we built programs back 15 years ago and there was a different community situation going on then. So taking this time to really thoughtfully consider what's currently happening in the community. And then from that, holding aside your vision for your activities, or holding aside what activities have gone on in the past, to think about, okay, understanding the updated information we have about our community. What are our goals today? What would be our goals today around ensuring that we were meeting the needs, gaps, in their community, taking advantage of the strengths currently available in our community. After you've thought about goals, objectives come from the goals. So we have a general direction of this is what we want to accomplish, but objectives specifically, how will we hold ourselves accountable? So what will change within what time frame to meet those goals? And then thinking about activities. So I think too often nonprofits start here in this activities column and think about what do we need to do? How do we need to help? So you might have a well-meaning group of teachers who say, kids really need an after-school STEM program. That's what they need. There's too many kids who are not developing STEM skills, and we really need to do something about that. So we need to have a STEM camp program. But I think if you peel away and take a larger look at the community, you might find that there are other organizations besides the school system who are delivering effective after-school STEM programs. You might find that you think that the community needs STEM programs, but the kids aren't interested in the STEM program. So really what you need to do is a marketing program to help kids be interested in STEM. I think once you peel away the layers through thinking about the needs, gaps, and strengths in the community, you really have a much better chance of creating effective, successful activities. Importantly here too, it's very important to me to think about both the process and impact outcomes of the work that we do. Process outcomes typically are outcomes that are a reflection of did you do what you intended to do? Did you serve the number of people you intended to serve? Did you have the reach? Did you accomplish what you said you were going to do? And the impact outcomes are, does it matter? So what's the value of the services? So you, thinking about the after-school STEM program, you intended to create an after-school program that met for 20 weeks and served 15 children. Process outcome, did you do that? Did you serve 15 people, 15 children for 20 weeks? And an impact outcome would be, did they actually learn anything about STEM? So how can you demonstrate that this program was valuable in terms of your goals of helping children develop skills and knowledge in STEM? And then we also add a column for research and data. This helps us to just make sure we're in tune with really the needs, gaps, and strengths column, but that we're also connected to current thinking in the research literature. So we have this column here that is, in this case, for the Advocacy and Public Policy Division, is related to the National Position Description, Position Statement on Seizure-Safe Schools. But if it were a program that had to do with providing bereavement support, it would be current best practices in providing bereavement support specifically to people affected by deaths related to epilepsy. So we have a logic model for the organization. We just updated it in, from November to February. Our Vice President of Development took this on. And we have a logic model that's many, many pages and covers all of the aspects of Epilepsy Foundation New England. And we show that to the board of directors and other stakeholders who ask to be able to show that we've really clearly thought out the logic of the way the organization is set up. And in our case, the logic model preceded our strategic planning process. Our strategic plan, we had one in effect from 2017 through 2020, and we've just adopted our 2020 to 2023 strategic plan, and the logic model forms the basis of that strategic plan. So strategic planning, I think people hear strategic planning and people have a variety of responses to it, and not all of them are favorable. It can be seen as a huge, arduous task. It can be seen as irrelevant to your organization, just something we have to do because the board says we have to do it. And then other people love strategic planning. Spoiler alert, I'm in the I love strategic planning camp of things. And I think it's really important to work together as a community with your clients, your other stakeholders, your board, and your staff to really think about how can we have a path forward. And I want to share with you that as we approached the strategic planning process for EFNE, the very first meeting of the Strategic Planning Committee was to be April 1st. So to think about the timing of that, And I did have a thought for a few minutes of saying, this is just not the right time to engage in strategic planning. I was drinking from the fire hose, as I'm sure all of you were, as were all of my staff and stakeholders, and like, is it really fair and valuable to make people pause and do strategic planning during this time? And then I said, of course it is. We need a strategic plan now more than ever. Like, the house is on fire. The world is on fire. We need to really assess how we can go forward together. So we did create our strategic planning process, and I think everyone was really grateful for it. And then our strategic plan became the basis for our fiscal year 21 budget. And if we hadn't done that, I think we would be far less prepared to manage the uncertainties of the current world. Some people hire consultants to do a strategic planning process. I think that's fantastic when you have the resources to do that. Strategic planning consultants are very expensive, and I think often bring a process to the table that is frankly more complicated than most nonprofit organizations need. That's just my opinion. I haven't had the resources in many years to engage a $10,000 to $15,000 strategic planning consultant. And if you do, then definitely more power to you. It's great to be able to delegate this work to someone who can do it for you. The most important part of strategic planning for me is to create a 3-year action plan that has quarterly action steps under each strategic priority that are assigned to specific people. I consider the action plan of our strategic plan my work plan as the president and CEO. And I use that to communicate with my board about how I'm doing and to help them understand how the organization is evolving. And I also work with the staff, usually twice a year, to go over the strategic plan to ensure that we're all being true to maintaining the strategic plan as not only a document that's on someone's shelf, but a living, breathing, guiding force in our organization. And I just mentioned our approach in 2020. We decided to proceed, even though times are challenging. And then what we did was I delegated the leadership of this to my vice president for development, who wanted the responsibility of creating the strategic planning process. We had 3 meetings with a strategic planning committee, which was a group of diverse stakeholders, which included board, staff, clients, professional advisory board. And those meetings were held in a virtual space. They were each approximately 1.5 to 3 hours. We used just common strategic planning steps of thinking about where we've been, outlining what is happening in the world, a SWOT analysis, or strengths, weaknesses, opportunities, and threats. We reviewed our mission, we reviewed our vision, we reviewed our cultural values, and then we created a path forward for the strategic priorities of the organization, which we circulated for input to the entire staff team twice, to our board of directors, and specifically spent a lot of time in our executive committee thinking through the strategic priorities, and then invited input from our professional advisory board into the details. As I've mentioned, in my view, strategic planning now is more important than ever. Here's an example of the action plan of Epilepsy Foundation New England's current strategic plan. Our first strategic priority is to effectively respond to the pandemic and prepare to advance our mission in the changing world. For us, that means pivoting programs and services to effective virtual experiences, which we believe will have enduring value for our client population. And we decided to continue prioritizing children, youth, and families in our community. There's an endless continuum of people that we can serve, but we have to be realistic about the resources we have, and we've decided that our priority is children, youth, and families at this time. And then you can see that there's action steps. So the first is we need a virtual services guidebook. We anticipated accomplishing that in the summer of 2020, and we have actually already done that. Conducting regular program evaluation of virtual programs for continuous quality improvement, developing and implementing an effective virtual camp season, and so on. So I think once you have strategic priorities, in our case there are 4, it's up to you as a leader in your organization to think about what are the action steps that need to be taken in order to accomplish those strategic priorities. And then this action plan is also something that I use with other members of my team for accountability. So for example, the Physician Epilepsy Resource Room, AmeriCorps members to deliver the programs of managing epilepsy well. I can use that with our AmeriCorps program directors to help them understand that this is a priority for them in the first quarter of the coming year, i.e. summer 2020. Okay, so now we're going to just go through the aspects of the organizational assessment tool. And I would want to share with you some ideas that EFNE has implemented and things that your organization might consider doing to strengthen your organization. But before I do that, let me ask Katie if there are any questions.
Yes, we have gotten one. This person says, there's no real consensus about what health actually means for an organization. Some organizations equate it with culture, some others with effectiveness, yet others with employee engagement. How do you get different organizations on the same page?
So I believe the organizational assessment tool is a definition of a healthy organization when you can demonstrate strength in all those facets or all these facets we're about to talk about. I think if you, again, compare a nonprofit organization with a healthy individual, there's not one measure of health in a person. So it'd be silly to say that just because I exercise every day that I'm healthy, if I'm also eating 4 bags of potato chips a day and never go outside and get 3 hours of sleep a night. I think the same thing is true of organizations. Just taking one facet and saying, well, our programs and services are doing great, so we're strong, or we have a diversified revenue stream, so therefore we're organizational healthy, is challenging. So if I were working with a coalition and trying to get to a shared understanding of what is organizational health, I might start by sharing this tool with the group and asking for input on what do you think about this tool works for your organization and what doesn't work, and having a dialogue. I think if you found a bunch of nonprofit leaders in a room looking at the organizational assessment tool, you'd quickly find peer education, so that if one organization said, you know, the definition of a healthy organization is one that has an operating budget of at least $2.5 million, I think you'd quickly get nonprofit peer education to say, well, wait a minute, that's not the only thing that matters. And the organizational assessment tool, I should say, again, has a lot of research behind it. So it's not just some foundation's interpretation of organizational health. There is a ton of study that you can read about how they developed this, how they validated the tool, and how they came to the definitions that they came to. So thanks for your question.
And we have one more, which is somebody has asked if they can find your virtual services guidebook online.
Can't find it online, but if Michaela actually has it, and you can also email me directly. My email address is on the last slide. So in terms of human resources and volunteers, one of the first facets of the organizational assessment tool, something that I encourage organizations to do is have the staff do a self-study of their job description. What I did back in 2016 was ask each member of my team to report what they thought the goals of their position were, and to report what percentage of time the various aspects of their position were taking. I created a worksheet and handed it to them and said, tell me what you do. And it was important dialogue around ensuring people understood their job descriptions and improving their job descriptions. We have an organizational chart by function at Epilepsy Foundation New England, and would encourage you to do the same thing. Once you really pull out the functionality, you can demonstrate what the priorities of your organization are to other people who may be looking at your organizational chart. It's important for the staff, too, to understand where they fit in the broader picture of how the organization is moving together. Job descriptions are critical, and we do look at these usually every year. I encourage my team, as they're creating their performance evaluation, self-study, and their goals for the coming year, to look at their job description. And we work together to change their job descriptions as need arises. And then you should have a human resources manual. This was really important to me to create really early on in the first 3 months of my time at Epilepsy Foundation New England. I did use a consultant to do this for me because there are a lot of legal aspects to HR, and I wanted to be sure we got it all correct. So really outlining what the policies and procedures are in your organization, and defining things like paid time off and severance and sick time and sexual harassment, et cetera, et cetera. So if you don't have an HR manual, I think that's an important investment. Refining and reporting is the next tab on the organizational assessment, or the next facet of organizational health. So I think we're finding in reporting, key to this is program evaluation. You really don't know that what you're doing is effective unless you ask the people that you're doing it with or for too, how they relate to what you've done. And that's not just customer satisfaction. Did you like the workshop? It's did you learn anything? So post-test quizzes, for example, are a really good way to understand, we provide education, but did anyone actually learn anything? They might have liked the workshop or the presenter, but did they actually learn anything? And for us, we don't have a lot of resources for program evaluation, but we do think it's critical. So we have used interns in the past to create simple program evaluation surveys with us. We have used a small amount of grant funding from time to time. Whenever we can add program evaluation resources into a grant, we do that, and so that we can hire professional evaluators to create surveys with us and to really set us up for success, to have validated surveys ready for us to measure the impact of what we were doing. And in investing resources in this area, if you have clear program evaluation data, it's essential to communicate that to your stakeholders. So being able to say to your donor community, we offer 20 workshops to 1,000 people in 2020 is one thing. Being able to say 95% of the parents who participated in our parent workshops reported that they understood shaken baby syndrome when they hadn't understood it before, or whatever. You can demonstrate the impact of the work you're doing, and that usually tends to move donors more than the process outcomes do. This is a really challenging time for the nonprofit community, so I'm not saying take your limited resources and invest them in program evaluation right now, but it's something to think about as the economy recovers. And another important source of program evaluation support could be partnerships with local universities or colleges who may have students or graduate students interested in doing projects related to the work you're doing and might do this as part of their studies. So finances, the most important thing I can say about finances is it's critically important to have diversified revenue streams. This chart here shows the revenue streams for Epilepsy Foundation New England for fiscal year 20. So you can see we're sort of an event-heavy organization. Fundraising events include things like galas and golf tournaments. Then you see our walks for epilepsy, of which we have 7. We have a fundraiser for research every year. And then our conferences bring in revenue through partnership support. We also have a donation center that collects gently used household items and cloth, and through a partnership with the Savers thrift stores, turns those donations into revenue. You'll see appeals are not a huge part of our revenue. We do receive a fair amount of unrestricted gifts that are people who hear Epilepsy Foundation New England, and that's a cause close to them, and they send us money without us asking for it, which is delightful. You see our private grants and government grants. Do-it-yourself, we have a huge uptick in do-it-yourself fundraisers, especially Facebook. So these are fundraisers that people do for us that we have literally nothing to do with until we get a check in the mail. This could be a Facebook fundraiser, it could be a bake sale. We do ask for people to let us know when they're doing this, but we don't always know until a check arrives. Natty releases is we had an endowed fund contributed to the foundation, and we use that money in this year. Teeny tiny amount of program fees. We tend to charge people a copay so they have some skin in the game for conferences and camps, so that they don't blow us off when it comes time for the conference, and it's a beautiful 80-degree, low humidity June day, and they'd rather go outside and play. And then we have some funding from the National Foundation. So I think we have a pretty solid diversification of our revenue streams. We think about this and talk about this all the time. Being overly reliant on any one funding stream could be the mark of disaster for your organization. For example, our donation center is closed. Savers is closed. They just reopened in New Hampshire and Massachusetts. But where we were using $50,000 a month in their revenue for programs and services, we now have 0. So thankfully, we have these other sources of funding to bring us through. For our board, these are 4 things that I've done that I thought were really important. We established a nominating committee to ensure that there was constant attention to what we needed on our board, that our board was diversified, that our board continues to have roughly a third of the board be new folks every year. And I think that's an important peer-to-peer conversation for board members to have. So if you don't have a nominating committee on your board, I think you should strongly consider that. We created an ambassador program, so our board members volunteer to help us do outreach with donors and clients. They have a job description, they have a training, and they have follow-up. So for example, we might hand board member Jason a list of 10 people and give Jason just a brief description of who they are and say, hey, could you call this person and just check in and see how they're doing during the pandemic or otherwise, and ask them what their priorities are for EFNE. And in that way, we build stronger relationships in a way that we could never do with a very small development team and a staff team who has more work to do than they know what to do with. So this is really critical for development in particular. Board self-assessment, so there are board self-assessment tools. And I think once you have your board really get into doing this tool, it's surprising how engaged they can become in really thinking about how they can be more effective. And then finally, bylaws. So if you haven't looked at your bylaws, and especially if you're an executive director or a leader in your organization, your bylaws are really important, and they're an opportunity for a board discussion about how your organization works. We revised our bylaws in September 2016 and continue to monitor those bylaws on an annual basis to ensure they're still meeting our needs. Bylaws shouldn't be changed on a regular basis, but sometimes they get stale in an organization and people kind of forget, and years and years go by and you forget what your bylaws say. So read your bylaws. And it's not exactly riveting reading, but important to understand what the rules of the road are. So for marketing, first and foremost, do you have the basic things in place? Do you have a solid website? Do you have a brand that's defined? What is your logo? Does everyone in the staff know what the logo is and to include it on everything you put out there? Does everyone understand what the color scheme of your brand is? And do you have a presence on social media? So checking off the basics. In our case, we needed contractors to help us to develop a website that made sense to us. We used project-based contractors. So we have a website, and now occasionally we'll hire someone to do one specific thing for us, like, for example, to revise our brochure. Where we recently released a new program called the Hope Line campaign, and we used a contractor to ensure that we had a solid campaign in place. There's also pro bono folks that will help you with marketing strategy, and one of them is Taproot. So if you're not familiar with Taproot, I would check it out. We were able to attract an extremely highly qualified marketing expert who did a strategic overview for us on what the marketing challenges and strengths and priorities should be for EFNE. And then secondly, we had pro bono consulting from the Harvard Business School's Community Action Partners. They spent a year with us developing a marketing plan, which I'm happy to say we're going to implement this September. We knew we were kind of out ahead of our skis in marketing, and Harvard really helped us to think through how to go forward. And so, I mentioned strategic planning was more important than ever. So our strategic plan, one of the 4 priorities is marketing, to improve our marketing plan. So as we thought about our fiscal year 21 budget during this very difficult time, the board made the decision to fund a new position, a digital marketing specialist, because it's the underpinning of our strategy going forward. It's weird to think about creating a new position in a difficult environment that includes some layoffs at Epilepsy Foundation New England, but particularly in this environment, this virtual environment, marketing and digital marketing in particular is more important than ever. And we just don't have the tools we need to optimize social media, to understand the analytics of our website and Facebook and other social media channels in a way that we think is critically important going forward. I mentioned partnership. Thinking about your level of collaboration with other organizations in the community is, in my view, an important aspect of your organization's health. You need to be connected to others doing your work and your mission in order to be effective. So we have a number of important partnerships. I see that we're running a bit short on time, so I'm just going to highlight Sail for Epilepsy. So this is a gentleman who is a PhD researcher at Tufts Medical School who has epilepsy and decided last year to sail around the world for epilepsy. And so I saw an article, someone sent me an article from Tufts Medical School highlighting what this gentleman was going to do. And so I called him and I said, hey, I'm not sure if you're aware of this, but EFNE does a lot of work in the community. I'd love to come and hear what you're doing and what I'm doing and how we can work together. And it was really the start of a lovely partnership. It turns out that this person had been looking for nonprofit partners to fundraise with, specifically for him to fundraise for by raising awareness. And so I'm happy to tell you that the two main fundraising partners for Sail for Epilepsy are Tufts Medical School and Epilepsy Foundation New England. Easily, he could have chosen other epilepsy-serving causes, including Epilepsy Foundation of America, but he felt at home with Epilepsy Foundation New England, and I think part of it was that he felt that I could be trusted and that we could work together to really advance his mission. In addition, I have agreed and have introduced him to a number of corporate sponsors, I have no fear about doing that. I don't need to protect our relationship with our corporate partners because I know that if they decide to give for Sail for Epilepsy, they're not therefore going to give less to EFNE. And even if they do give less to EFNE, the most important thing is that Phil Hayden is raising critically important awareness across literally the world for epilepsy, which is more important than the $5,000 that may get redirected from XYZ company to Sail for Epilepsy. Okay, good. Well, that brings us right to 10:55, and that is the end of my presentation. This is my email address. If you have any things that I can help you with in terms of the material I provided to you today, I would encourage you to send me a note. Katie, are there any questions?
Yes, we have one more. This person says, business leaders have to attend to setting their targets, developing strategies, and allocating budgets. What emphasis would you use to drive a better connection between organizations that can enhance each other's business and the core values that they share?
Okay, I'm going to take a shot at this question. I'm not sure if I fully understand the content of it, but first I want to say that nonprofits are nonprofits, but they are businesses. So, I think sometimes there's this tendency in the nonprofit community to be a little bit more loosey-goosey about setting targets, about accountability. Because we're all doing the best we can with the limited resources we are, but make no mistake, a nonprofit is a business that requires strategic priorities, that requires benchmark setting. Everyone on the team should have goals and objectives that they're accountable for, and of course, we should have a budget that everyone understands and that we meet the targets for. So in terms of building connections to work together to meet those goals, I think across the nonprofit sector, having community collaborations that are constantly thinking through what's going on in your community and how to mobilize together and when to mobilize together is important. There are many, I worked for a long time in the city of Lowell, and there are many collaborations in Lowell that focus on bringing nonprofits together, often at a moment's notice, whether to respond to a community crisis or to take advantage of a funding opportunity. And there's certainly, I know, Volunteer New Hampshire has a lot of resources in bringing together the nonprofit community in New Hampshire. In Massachusetts, Mass Service Alliance, but also the Massachusetts Nonprofit Network are opportunities to bring people together. So I'm not sure if I got to the heart of that question, but you're welcome to email me and we can have a broader dialogue about it. Well, again, thank you everybody who decided to join us on Zoom on this beautiful June morning, and I just want you to pat yourselves on the back for all your work that you've been doing these last 3 months. If you're like EFNE, and I'm sure you are, it's been really, really hard, and we've been all working super hard to create new services and respond to the pandemic and diversify revenue and stay alive. So we're doing great work, and our work as a nonprofit community is more important now than ever. So thank you for making time to learn together, and I hope you like this presentation, and thank you for coming.